even stupid things. Like you go to a restaurant, and it's a longer wait than you thought, and everybody's going, let's go someplace else. No, I want to go here. And on the surface, people with this issue appear selfish. So we would give them a moral tag, a moral judgment. You are selfish. When really that's not it. It's they're inflexible. It's like their brain gets in a tunnel, and the tunnel has no windows and no doors, and they feel like they have no options. And you know when people kill themselves? It's when they feel like they have no option. So this type is associated with suicide. And you know, one of the best treatments for oppositional children is to teach parents how to be superior parents and more effective. Because what happens if you let somebody argue with you? They've done studies on people who get into their obsessive thinking. Flames their cingulate gyrus. If you allow your child to ask you the same question, badgering you, for 2.5 hours, you are doing nothing but solidifying this abnormality in their brain. Good parenting is very important. You have to parent for their brain. I mean, one of the things that we do for obsessive compulsive disorder is a treatment called thought stopping. You know, if you get this thought in your head over and over again, you got to go, stop it, and go do something else, or wear a rubber band and flick it hard. It's like, this is an abnormal thought based on abnormal brain chemistry. I'm not giving into it. And stick your tongue out at the thought. But when you let a child argue with you over and over and over again, you're just making it worse. So in my refrigerator when my children were little, because 1 or 2 of them had this natural tendency, I put rules up. And one of the rules was no arguing with parents. Now in parentheses I put, as your parents, we love you and we want to hear your opinion. More than twice constitutes arguing. And so, you know, I want to go to this concert. No. I want to go to this concert. Caitlin, because she was the guilty one. Caitlin, I said no. No matter how many times you ask me, I'm going to say no. But if you ask me again, you're breaking a rule and there's going to be a consequence. And she would like turn around in a huff. But we wouldn't like do this dance that people do. I had one patient said her son would follow her around the house asking her the same question for 2.5 hours. No wonder these kids get abused. And it's often ineffective parenting. So if you're conflict avoidant, okay, you have basal ganglia issues, you're conflict avoidant, and now you have an oppositional child. I want to do this, no. 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 Okay, do it! What did you just teach that child to do? You just taught him to harass you to get his way. It's a very bad thing. If you have no backbone, just say yes the first time. Better to get a backbone, since we are not jellyfish. Now, as you will notice, cingulate gyrus problems are involved in lots of different psychological or psychiatric problems. When it's too low, actually a group of neurosurgeons over at UC Irvine in the 50s described a condition with cingulate gyrus damage, and they called it akinetic mutism. What that meant is they didn't move, akinetic, and they didn't talk. They just were just sat there. When it's too high is usually what we see. They have anxiety disorders, and they can't let go. So this is the person who has a fear of snakes or a fear of ants, who like goes to extremes to avoid them because they can't like stop thinking about it. Post-traumatic stress disorder. What's that? You get stuck on a traumatic event in the past. Obsessive compulsive disorder. Get stuck on certain thoughts or certain behaviors. Much more common than we used to think it was. Eating disorders. You get stuck on I'm too fat, I'm too fat, I'm too fat, even though you might be 5'7" and 85 pounds. It's stuck on addictions, drug addictions, alcohol addictions, smoking addictions, gambling addictions, sexual addictions, Los Angeles Lakers addictions. And they can be oppositional. And you know they're oppositional if 9 times out of 10, you say 10 innocuous things to them, they argue with 8 of them. It's a beautiful day today. Oh, it's not that nice. It was better yesterday. When you get that, that's when you have to start thinking about cingulate gyrus problems. And their automatic first response is no. Their position in life, that's where they start, with no. Their first words in life were no. Their first short sentence in life was no way. Their first complex sentence in life was you can't make me do it. Now, how would that upset relationships? They don't cooperate. And if you're parenting one of these children, pretty soon you stop spending time with them. Why? Because you're tired of it. There's no give and take. We spend time with people who return love, affection, attention, and so on. So what we see on scans with obsessive compulsive disorder, or OCD, is increased activity in the cingulate center. We also see it with road rage. Can't stop thinking about that guy that cut you off. We see it also with stalkers. I mean, what's a stalker? Somebody who can't let go. This is the little boy that always said no. When I looked at the scan, I sort of thought this is a behavioral mohawk. He had a mohawk haircut. That's what it looked like in his brain. The mohawk was just an outward manifestation of an inward state. So an over-focused anxiety and depression. They worry, they're upset if things don't go their way, they tend to be oppositional, argumentative, they have repetitive negative thoughts, sometimes compulsive behaviors. They don't like change. They like things the way they like them. They hold grudges. I don't know if you saw in the paper a couple of months ago, the Hatfields and McCoys were still going at it with each other, you know, like 150 years later. Can't let go. One has to wonder about the Middle East. If they're not societies that have been traumatized, that have PTSD and can't let go. I think you should get the leaders of Palestine and leaders of Israel in a room. Scan them. Give them some Prozac. Don't let them out. Because what do they do? I mean, it's gotten to the point where it's psychotic. I'm going to go blow myself up because I'm so mad at you. I can't think of anything else. So I'm going to go in the middle of the marketplace in Jerusalem and blow myself up. That's crazy. They can't see options. They hold their own opinions. They don't listen to other people. And they say no without thinking first. And that's when you see them in your office, and you will see many of these people through the years. No matter what it is you say to them, they argue with you. Your first interpretation, they're going to go, that's not true. Now what I want you to do, not initially, but after you've seen them for 3 months, is if you've noticed this thing in them, what I want you to say to them is, you know, it seems like no matter what I say to you, you argue with me. And what do you think their first reaction to you will be? No, I don't. At that point, the only thing I want you to do is smile. And then I want you to say, well, you know, that's sort of how it seems to me. What I would like you to do, if you want to get better, I usually throw that in to motivate them a little bit, is I want you to watch your natural tendency this week and see if it isn't to argue. And they go, but I don't do that. And I say, I know you said you don't do it, but I just want you to watch. Whenever anybody says something, if your tendency isn't automatically to formulate an argument in your head against what they said, even silly things. Okay. Because then they'll usually cooperate. 8 times out of 10, they will come back a week later and go, I do that. It's a huge breakthrough, because then you could go, do you want to do that? And they go, well, what do you mean? I said, well, do you want to be a chronically difficult person who's always arguing with people? No. Okay. So when people ask you, just know it's your natural tendency. I mean, we all have natural tendencies to this or that. No, that is your natural tendency. And before you say no, take a breath and go, what's my goal in this situation? Do I need to say no? I have this great example. I was in Washington recently, and a friend of mine said to me, he said, oh, Dan, he said, I'm so grateful for all the things that you've taught me. He's another psychiatrist. He said, especially about the cingulate gyrus. I'm married to a woman that has a cingulate gyrus from hell. I said, what do you mean? He said, since I've listened to you, I've realized I never ask for things directly. I always have to ask for things in the opposite. I said, the opposite? He said, yeah. He said, if I want to go to the store, I used to say, honey, would you go to the store with me? And she would always argue with me. I can't go to the store with you. I'm so busy. Can't you see it? That's so insensitive of you to ask. He said, no, I never ask for something directly. I say, sweetie, I'm going to go to the store. You probably don't want to go with me. What do you mean I don't want to go with you? Of course I want to go with you. I love you. What's the matter with you? Why would you ever think that? And he said, you know, that really works for them. In fact, there's this thing in family therapy, it used to be called paradoxical intention or paradoxical request, reverse psychology. Ask them to do the opposite of what you want them to do, and they'll do it. But this doctor looked at me and he said, but you know, Dan, I'm having trouble with the sex thing. He said, it doesn't sound right to say, you know, I think I'm going to go have sex. You probably don't want to come with me. He said, do you have any ideas for me? I said, yes, I'm sick. I think about this stuff all the time. I said, yeah, take her out for a pasta dinner. Because what we find for this group, simple carbohydrates seem to be helpful. They make them more flexible. They don't concentrate better, but they, you know, the problem with this is they concentrate too much on the things that bother them. So take her out for a pasta dinner. And then take her for a long walk around the lake where they live. Because exercise boosts serotonin levels in the brain. And then bring her home. Give her Godiva chocolate, never hurts. Rub her shoulders, and never ask for anything directly. And between day 4 and about day 16 of her menstrual cycle, you're likely to get lucky. And about 3 weeks later in my email box, I got these, thank you, thank you, thank you, thank you, thank you. I love that story. Their work. Being married to someone who's overfocused is work. And do not make them mad. Don't cheat on them, because they'll never forget it. Right? You got to give them a lot of Prozac, or they will never forget it. All sorts of DSM-4 diagnoses associated with this type, from OCD to what we call OCD spectrum disorders, anorexia, agoraphobia, addictions, oppositional defiant disorder, and Tourette syndrome. People with Tourette syndrome, half of them have obsessive compulsive disorder at least. All right, when we look to treat this type, ANT therapy helps. Thought-stopping techniques help. Exercise helps. Diet helps, but this one more carbs, not the Atkins diet. Not a good idea. Meds, basically SSRIs, and supplements. And the meds, We use things like Paxil or Lexapro or Prozac. Effects are if they have low activity in their frontal lobes along with a hot stimulant. For really, really terrible overactive singulates, we'll use the novel antipsychotics like Risperdal. And from a supplement, we'll use St. John's wort or 5-HTP. The next type is what we call cyclic anxiety and depression, where they have focal increased activity in their thalamus, these big hot spots, but usually on one side or the other. And often what we call patchy increased uptake. It just looks like somebody took their hand in paint and threw it on the canvas, and they just got hot spots all over the place, which looks almost like seizure activity. So, it could be as mild as PMS or as severe as bipolar disorder, but what you notice is they have cyclic mood changes. They're fine, and then they're not. They have energy and sleep changes. So there's times they may be sleeping too much. That's when they're down. Other times they don't need to sleep because they have lots and lots of energy. They may have grandiose notions when they're up, or they may have pressured speech or talk too much, racing thoughts, bad judgment, inappropriate social behavior. In fact, you often wonder about, this person never did anything wrong and now they molested their secretary. Were they in a manic episode when that happened? So they often have poor judgment. They can be really irritable, sometimes aggressive, and can be delusional or have psychotic thinking. What you see in bipolar disorder is you see cycles. Now we think of as bipolar 1 or classic bipolar disorder is they're normal for periods of time, depressed for periods of time, and then they're flying high for periods of time. Bipolar 2 is they have rapid cycles. They're not up or down for weeks at a time. They can be up or down for days at a time. So different psychiatric disorders, from bipolar to cyclothymia. Some panic attacks are based on mood cycles. This is our first bipolar brain, woman who had been diagnosed bipolar, put on lithium. Lithium helped her, but she kept stopping her medicine because she didn't believe she had a problem. After she saw the scan, she stayed on her medicine because she could see it. It was a medical problem. Pattern we call the ring of fire. This is in someone before treatment on the left and after treatment on the right. I mean, it's very exciting to get them better balanced. Treatment for type 5, high protein, low carbohydrate diet, because that tends to lower the seizure threshold and tends to settle down brain activity. The meds we use are anti-seizure medicine. Now, they have bipolar disorder. We don't use Neurontin. It's not strong enough. We'll use things like Depakote or Tegretol or Lamictal. Neurontin is really good for anxiety, for irritability, and pain issues. If they have cyclothymia, Neurontin might be fine. But if you get into a psychotic mood disorder like bipolar 1, Neurontin is just, or Gabatril or Topamax, they're really not strong enough. Sometimes we'll use the novel antipsychotic medicines like Zyprexa or Risperdal, the new one, Abilify, that people like a lot. The next type we call temporal lobe anxiety and depressions, where abnormalities in the temporal lobes. Temporal lobes are a very important part of the brain. They're involved with language and memory, mood stability, listening, reading social cues, rhythm, music, spiritual experience. They're very important structures in the brain. When there are problems in the temporal lobes, you have emotional instability, memory problems, panic attacks, sometimes aggressiveness, and the aggressiveness can be external, I'm going to hurt you, or it might be internal, going to hurt myself. They may have bad headaches, and they often have learning problems. Even though they're really smart, they might have trouble processing what they see or what they hear. Lots of conditions can be involved with the temporal lobes, from learning disabilities to epilepsy to dementia, sometimes aggressive and suicidal behavior. Brain trauma is very common. Too much activity can be seizures, mysticism, spiritual experience. Temporal lobe anxiety and depression is you have anxiety and or depression. Typically you have both, plus temporal lobe symptoms. You might have a short fuse, you might have a rage reaction. Misinterpret information. You may be spacey, have periods of anxiety or fear for no particular reason. Auditory changes, they may be sensitive, a little bit on the paranoid side. You may have headaches or tummy aches. You may have a head injury, family history of violence. The one thing that really stood out for me when we first started doing with this was the dark, evil, awful thoughts that sometimes came. They may get the diagnosis of epilepsy, or they might have a cyst in that part of the brain, might be damage from trauma. Sometimes they have this thing called intermittent explosive disorder. For no particular reason, they explode. The treatment for this type is biofeedback over the temporal lobes. That can really be helpful to stabilize them. Diet, fish oil, so higher protein, lower carbohydrate diet. The meds we use are basically anticonvulsants. And sometimes if people want to try a supplement, we use the natural supplement GABA, because GABA tends to inhibit overfiring in the brain. The last type, something we call lights or low, overall decreased activity in the brain. And what we see is they might have trouble focusing, spaciness, feel like they're in a fog. They get overwhelmed by their life. They just don't have the mental energy. They feel sluggish. They procrastinate. They're bored. They lose things. They're distracted, forgetful, have trouble planning, trouble expressing empathy and their feelings. Now notice, we have a diagnosis of depression. Can be major depression. One brain is hot. One brain is cold. The treatments are not the same. One you want to calm down, one you want to fire up. So it's important to know the differences. So often this one they'll get a diagnosis of depression with cognitive impairment. They may get a diagnosis of ADD, but it's really due probably to some sort of toxic substance. Maybe chronic fatigue syndrome. This is an example of chronic fatigue syndrome. Not nice. This is a relatively new scan that we did on a woman that was very depressed. She had a heart attack when she was 18 years old. And she had a loss of oxygen for a number of minutes. And you can just see, just severe damage overall in her brain. We're doing hyperbaric oxygen treatment with her. I'm excited to see after 4 or 5 weeks if we'll actually see a change in the scan. The treatment for this is you got to get better blood flow to the brain. There's a treatment called transcranial magnetic stimulation. They take powerful magnets, put it over your skull, and increase blood flow and activity to that part of your brain. Sometimes biofeedback can help. Hyperbaric oxygen treatment, where they put them in chambers to really drive oxygen into the cells. Exercise can help. Diet and fish oil. The medicines we use, things that stimulate people. So we might use Ritalin or Provigil or Strattera, things like that. There's no question you can have mixed types. This is a 17-year-old boy who came to us. He had, when he was 3, he had a cerebellar tumor. And he had the tumor taken out. But they had to go back for a second surgery, and after the second surgery, he developed a brain infection. He developed meningitis. And it basically killed a lot of the function of his temporal lobes. And from the time he was 3, 17 now, he's had terrible epilepsy. Some months he's had 45 to 60 different seizures. And he's been on multiple medications. His parents are very sweet. They actually run the Tustin Center, which is a school dedicated to children who've had brain injury. And as I sort of listened to the story, I went, there's no way this kid is optimized, because he still has OCD. He still has a lot of anxiety. He's still very sad. And so the neurologists have been focused on the seizures and not focused on his mental health. And so when we scanned him, which you see this is his scan, the image on the left, terrible temporal lobes, especially on the left side. Terrible problems with his temper. But you know, he has to have things his way. Things don't go his way, he explodes. And the one episode they talked about was waffles. He wants waffles in the morning. And Mom ran out of waffles one morning. And he chased her around the house with a knife for 45 minutes. Now you look at his scan, you go, he's got terrible temporal lobes, and he's got the cingulate gyrus from hell. And you understand why people do. So here you have to target the temporal lobes, because we always target the temporal lobe or cyclic type first. I should write that down. Target the temporal lobe or cyclic type first. And then you can go after the cingulate gyrus. If you get it backwards, you may in fact make these people much worse. You remember recently the FDA had this big hearing about antidepressants in children. Antidepressants cause suicide in children. The FDA is asking the wrong question. Do antidepressants cause suicide in children? Yeah, the wrong ones do. Just like they cause suicidal behavior in adults. Right? You might not remember, but 12, 13 years ago, there was this big hoopla in the media about Prozac makes you kill your mother. Not usually, but if you give it to the wrong person, it can make them aggressive. The same thing's true with children. So if you have the temporal lobe type or a cyclic type, you got to treat those first, because if you don't, the serotonin medicines can make people crazy. Got to get the treatment in the right order. Now, when we assess these types, clinical history is the best thing. If you can't get a scan, you're going to yourself, I can't get a scan, how is this helping me? I'm giving you the symptoms for each type, right? You need to screen them for. Now, collateral information is helpful. Get information from the schools, for kids, from siblings, spouses, parents, and watch how it develops over time. If they were fine and then they had a head injury, that could trigger it. If they were fine and they had a stroke or they had a heart attack, that could trigger it. If they were fine and they got a new job in a furniture factory, now they're around solvents all day, that could trigger it. We have a very nice checklist I'm happy to share with people. You can email me and I'll send it to you. It's specifically for anxiety and depression. It comes out of my book, Healing ADD, Healing Anxiety and Depression. DSM-4 is useful, but